Hey, Dr. Jon Swetech here. Let's talk about medical weight loss. It's summertime. As you can see, it's nice out, so we'll talk about some of the main medications. So I'll just list them off. If you're interested in any of them, come on in, we'll talk about them and if they're right for you. We do know the tricks and things, so it's a little bit more complicated than just writing a medication, and there are a lot of circumstances that need to be met so for them to apply to you. But first off, the most basic one is metformin. This is a diabetic medication, but it increases insulin sensitivity and can really help people lose weight. It's usually not huge, but I have seen people lose over 100 pounds on just metformin, so it's a great option. Go along with the diabetic medications, there's injectables that kind of slow the digestion down and kind of give you a forced intermittent fasting state. Originally there was Victoza, which is an injectable. It's a small subcutaneous injectable. They came out with Saxenda, which is basically the same medication but rebranded. These medications work really well if you're okay with injectables. Next medication that seems to be the most popular that a lot of people have great results with is Adipex. This kind of turns your whole metabolism on high drive. You do have to be very careful. It can make blood pressure go high. It can worsen anxiety. It does have its place. I do find that people zigzag a lot with this one, so it does have its place, but I think there are some better options in a lot of cases. I've seen a lot of people have great results, and a lot of other offices use it very extensively, so it is always a great option. They combine it with Topamax to make this medication called Qsymia, and that one is probably the most effective, and I think Topamax by itself works really well too. Basically cuts down on food cravings and urges and things like that. I use Topamax a lot and have had some great results. It helps with people that have trouble snacking. The antidepressant Wellbutrin boosts dopamine in the brain, so people that have these food cravings and things like that do well. I've seen a decent amount of people lose a significant amount of weight with Wellbutrin, and also helps with smoke cessation, so that can get two birds with one stone. They combined Wellbutrin with a medication called naltrexone to make Contrave, which is good for people with food addictions, I find. It's a little expensive and not covered very well, but it's supposed to work well with people that have very addictive personalities, things like that. So there's a few other kind of newer ones. There's Orlistat. I think they go by Xenical and Ally. They kind of cut down on fat absorption. These have a lot of side effects too, and I don't really write a lot of them. There's a new one called Belviq, which does something with serotonin in the brain and cuts down on hunger and things like that. Truth be told, I don't think I've ever written that one. Maybe a refill on it, but I've heard mixed things about it. On top of that, I've seen a lot of people use diuretics to get rid of water weight, and it does bring the scale number down, so a lot of people like it. But people do like that too. It does change your physique a little bit, so especially if you have high blood pressure or a little bit of swelling, diuretics are often used. I'm trying to think what else. I did make a little list here for me to make sure I got them all, but on top of that, you got to look at the full picture. A lot of times people have hormonal imbalances, whether it's with the insulin, whether it's with thyroid or male or female hormones, and a lot of times if you treat those things, you can have great results. So you got to make sure that all that stuff's in line. If you're interested in kicking your weight loss up a notch, get in. We'll talk about your options and figure out what we can do for you. We've had a lot of patients do great work. We talk about dieting and exercise and things like that on top of it. And we seem to have really great results. So nice talking. We'll see you later.